All right, this is the new Prezi. So my name's Steve. I have a couple hats that I wear, wear in the civilian world, the military world. So I'm a U.S. Army chaplain. So the chaplaincy, just like in 40K, my job is to encourage the soldiers and to provide for them morally, spiritually, and ensure their religious freedoms are done. As part of that is really we have more chaplains that are available. So like myself, I'm an LCPC, which means I have a clinical psychology master's. And then I also have my own practice called Safe Harbor Therapy. So this discussion, we're going to kind of talk about, areas of focus. I'll talk about a little bit of my experience using wargaming and gaming in general in a therapeutic sense. So this is kind of our coverage slide that I'll try to get to. And if I'm talking way too fast, it's just the coffee kicking in, but the brain's kind of lagging behind. So just let me know. So PTSD, cult recovery, those are kind of my two specialties. I've been on the Dr. Phil show talking about cults and how we deal with that, which is a traumatic incident where the person has to kind of come over. The problem with PTSD in general, and I'll talk about this little area, is it's the criteria in the DSM is one instance. So complex PTSD will be coming out soon, hopefully DSM-6, which will actually take us into another realm of, hey, here's trauma, here's a prolonged deployment, or my dad abused me as a child. So that'll be better as well. So kind of talk through that. And then just some fun facts, like being a counselor, and then also in the military realm as a priest. I'm a certified exorcist, took that training. So lots of hats that I different wear, but kind of come from an eclectic viewpoint is where I've used this. So PTSD, like I said, it has a long history going back to World War I, and then we could see it throughout history. But PTSD is often, it's more like complex PTSD, which is a series of events that builds up and traumatizes people, versus like when I was in Iraq and we got mortared. That, according to the DSM, that's the triggering event. That very moment in time of getting shot at, but the whole entire deployment being afraid to go to the bathroom because one of our bathrooms got blown up. And I was like, every time I went to go poop, like, is this when I die? Because they blew up one of our bathrooms. So PTSD in general is a very limiting diagnosis, but there's several aspects of it that come into play when people come after the traumatic incident. So you have memory issues. You'll have avoidance around it. You don't want to be around people. Other things that'll kind of disturb you, like you'll talk about it as though it's nothing. So an example would be, I talked to one of my friends he's like a brother to me. He talked about in when he was in Afghanistan, they were taking mice and they would catch mice and then they would pour gas on them. They light them on fire. And I'm like, oh my God, dude, we need to talk. And he's like, whoa, slow down there, chap. He's like, earlier in the day, they had bombed a girls' school and we had to put the little girls back together to see how many they killed and see if we could identify them. And I'm like, all right, yeah, burn the fucking mice. Like, dude, holy cow. Like, so you've got a different level of that. So PTSD is a wide spectrum. So I just want to kind of set the ground rules. It's not like this is the treatment that'll solve PTSD. It's just a tool that we can kind of do, because your thoughts and your feelings and your behaviors are always going to be modified. And once those kind of root into a person, it's kind of, how do we get them out, and how do we use cognitive behavioral therapy, EMDR? There's a lot of different tools that are out there, but that's in an instance of therapy. How do we take the therapy and extend it into somebody's life? And that's what I've been doing in the military and with combat veterans outside the military now, because PTSD, like I said, it's a very limiting diagnosis, but I would say that it's higher than the 30% that the VA is reporting. But in addition to just combat, it can also apply to real life scenarios. Hey, I was raised in a cult, so I have a cult support group that I can provide the same type of relevancy to of PTSD, because it's not just soldiers. But again, I just wanted to kind of narrow it down for the conference and kind of make it there. Like I said, the traditional therapy is a great tool. It's awesome. I mean, that's what I do for a living. The problem is that it's in a one instance, right? I have an hour a week with the patient, and then after that hour, what does the patient do? How do we take our modalities? CBT, what I love about it is you can do a thought journal. It's something they can cognitively do throughout the day of, hey, what's my internal belief? So I'm not going to go through here because this is a deck that I use to get my commanders buy-ins or other groups buy-in. So 40K, everybody knows what 40K is. But what I like to highlight is think about it when you're playing on the tabletop of how much cognitive engagement and emotional exploration you can have, and how that can help for combat veterans or anyone that's experienced any type of PTSD moments. Because 40K it's more of a very safe environment, meaning that there's left and right boundaries, right? I can't say my greater unclean one can move 24 inches, or my Wraith Knight can, shoot 15 weapons. No, there's very distinguished rules within it. So you're immersed in a story, but it also has the mechanics to support boundaries. And boundaries is one of the biggest things that I hit on with most people. I'm not going to go through that. That's my buddy and I playing. All right. So the immersiveness is where we can kind of start to understand where gaming in general can help in a therapeutic sense. So that therapeutic sense comes into where I'm immersed into and a part of that universe, right? So I am feeling, I am sensing, I can even sometimes smell. If you have a really good DM in Dungeons & Dragons or Star Trek role playing, which is awesome, I love that one. The new one's awesome. You are engaging it just like engaging, but because you're in this bubble, you have a different persona that can come out, and that's what we're talking about when we start to really understand why we can use this immersive gameplay into our own storytelling of our own selves, because we can reflect on our own experiences and be like, yeah, when I play, I don't know, like Custodes, there's not a lot of them, but I'm confident because they're tough. Or when I'm playing a horde army, like I feel comfortable in all this stuff around me and moving it and confident and telling my opponent my rules, my special abilities. But then I leave the game store, my basement, and then my boss challenges me and I kind of shrink up and I don't know what to do, or my PTSD kind of traumatized me. I'm right back there in Iraq getting shot at and I can't move forward, even though I could do it while I was in the game in a totally immersive experience. So that's where the benefits of therapeutic benefits of 40K come in, right? So this is, again, therapy is 1 hour a week. And now we're taking what is an average game. I mean, if you're going to tournaments, it's 2 hours and 45 minutes. But usually, let's face it, all of us, when we're playing Garage Hammer or Basement Hammer, it's like a 4-hour process because we're talking and everything else. And really what starts to come in, and this is a picture of my soldiers just working together, right? So this is them. All of them are from different parts of the United States, different backgrounds, different ethnicities, different parents. Yet in this group, we have an eclectic people from the LGBT group, from different racial groups to different age groups and different and moral and religious groups in there. But yet they're all benefiting together because they're working together. So same thing with Warhammer is we've got different rules, we've got different armies, but we also have different people, right? We have different people on this call, I'm sure, that have a different viewpoint from it, right? So I always like to use this meme with my soldiers, because if you've ever seen Trailer Park Boys, like their culture in Trailer Park Boys is swearing, drinking, smoking, all that stuff. And just like 40K, it kind of allows us a narrative and a unique love language, as I always like to tell my soldiers, to talk to people, and how we can say, all right, hey, here's our 40K, here's my little Space Marine, hey, here's my sister's army, hey, here's my Orcs army, and then here's my Grey Knights, which are the best faction out there. My Grey Knights are going to come in, and I can, I'm a murderous, but I'm also the elevated, like keeping the universe clean. And then the sisters are like, well, we're kind of on the same page, but F you, we hate you because you killed all those humans. And then the Space Marines are like, oh my God, I saw a Grey Knight, like something's going to go bad, right? So you have all these different unique languages that we can now speak to each other, where sometimes with PTSD, you don't feel that you can communicate because you have so much racing through your thoughts, or you're constantly in that panic mode. So we're able to frame for a moment of that 4 hours into a different type of mindset. And then additionally, I think one of the things that with veterans specifically is it allows you to still think strategically, right? Like, so, when I went through Captain's Career Course or or BLC Free Enlisted or any of the other ones, we start talking about strategy and how to, flanking maneuver, buffing and all that stuff. So they're able to kind of use those skills that they used in the Army, because one of the biggest things that I run into in the private practice treating PTSD in veterans is they lose the camaraderie, and then they don't get to use all those skills, right? So if you spent 20 years as a combat infantry soldier, and now you're trying to make it as, you know, a project manager at a firm, you've got different languages, you know, calling people idiots and morons. Like that's just part for the course in the military. If you went into the corporate world and called someone a moron, things are going differently. So you're able to use your skills still a little bit, and that love that comes out in additionally to that is kind of that gameplay, right? Like we always give each other crap. Like I was at Adepticon and these two guys were playing, and this Dread Knight would not die. It's a Dread Knight. It would not die, but they were able to joke about it, and they were able to bond about it. And throughout the whole 4 days of Adepticon, they were able to still, hey, what's up, man? Like, even though they had only meant for one game. So it improves that strategic thinking. And then that social interaction of afterwards is where you start getting into the benefits, just like this on an obstacle course, right? All of us here probably watch somebody stream 40K. Soldiers will sit around here and watch the tower and cheer on or make fun of each other as you're like, you know, doing it. Like, so earlier in the day, I ran up that thing in my, so chaplains, we have a bodyguard, we have a chaplain assistant. He was freaking out. He's like, sir, slow down, slow down. He's like, I'm not explaining to your wife why you fell and broke your leg. You know, and it's that social interaction can revisit that interaction they had in the military, which is, that social piece is so huge for soldiers coming out of the active duty, especially. All right, so kind of getting into the, you know, clinical, right? So we've got cognitive and emotional entanglement, right? Engagement. When we think about a game of 40K, we're not just rolling dice. I mean, we can have those opponents. We can, you know, just go there and roll the dice and play with it. But typically, especially in a tournament setting, it's a lot of camaraderie. It's a lot of fun. But you're also learning how to regulate your emotions, right? You're going to meet people from all walks of life, all different aspects of it. And with PTSD, what happens problematically is that you can't process the trauma because it'll trigger internal trauma. You can't process those triggering events. So what this allows us is to do, like, let's say your opponent is a D-bag, is an ass, just a jerk. You're able to go, okay, you know what? That person that's the way they're going to be. And if I want to have fun at this event, I'm going to have to regulate my own emotions and start looking at what is impairing me. So this is a picture of my soldiers. These are the leaders of my D&D therapy group that we used to approach these cognitive impairments of, hey, I can't react to somebody. Like, I had one of the soldiers started choking another soldier during D&D. Like, in his brain, he was a threat, so he started choking him. And thank God one of the other NCOs was like, be able to break it up. But we addressed, hey, what were you feeling in that moment? Because you reacted in the real world, and you don't do that in the game. In the game, you're like a paladin. You're doing all this amazing stuff. And same thing with 40K. Hey, you're cheating, and I can call you out on that without being angry and getting into those knee-jerk reactions. So that's where we get into the executive skill functioning. So as in the game, we can play 40K and start to build those muscles of, hey, I'm going to be triggered if somebody cheats me, because cheating means that you're not doing your part, and doing your part is that's how Tim died, or that's how, you know, we got into a Humvee accident, right? So like the guy driving the Humvee, my Humvee, that decided to go 45 miles per hour in the field and threw me around the Humvee, and now I have permanent neck damage. Like, those moments, I could really hate anybody that looks like him or sounds like him or does anything. But using 40K, you can kind of start to interact with those people and not be triggered. I'm trying to go for it faster, sorry. And then the aspects of miniature painting, right? So the ability to, you know, Zen moment, that Buddhist moment, or whatever you want to call it, where you're able to kind of and then express yourself in paint. And I had to do a little shout out to Battletech, because that's my first love. So that allows that creativity. And we know creativity and artistic expression. Art therapy is an amazing modality of therapy. And the ability to put your feelings into paint and terrain is just phenomenal. So like my soldiers, we were EOD, so we're the bomb squad. These are real bullets. These are real 40, you know, like 50 cals and 5.52s. Like, I put these on the stands, and they thought it was amazing. They just thought it was so cool that I could express part of their experience on miniatures, and it was a really huge ability for me to open up doors and talk about, hey, what was it like when Afghanistan when you got shot at, or hey, well, in Afghanistan when you lost 5 people, what was that like? So there's all sorts of benefits for it, but the problem is with 40K, there's little research, right? And then there's very few academic papers, and that's so awesome about this conference is that, like, how do we capture this, and then how do we forward it, right? So I'm the Army esports chaplain, so I'm the chaplain for the Army esports team that has an Army of 40K esports, and I get calls all the time, at least once a week, if not 2 or 3 times a week, but at least I get one suicide ideation from the 40K team, because it's huge, it's across there, or any of the other esports, and they reach out to me because, hey, chap, you were talking about 40K and how Magnus did nothing wrong because he didn't. And that allows me to kind of get in their minds, and then I can start to help them through gaming reduce those symptoms. I was able to play with game with a soldier, hey, and then during that game, his anxiety and depression levels maybe came down because he doesn't feel alone and isolated, and because he's in a safe environment, being able to walk through those trauma moments of getting overwhelmed or getting overrun, and his custodes are getting overrun by my guard, and I'm killing him. So there's a lot of opportunities for it. So, and then this is me with the Army esports team at Adepticon. Because you are able to get into a social and community, right? All of us are here because we love 40K. It's awesome to have that community. When you leave the military, you leave a brotherhood and a sisterhood that is very unique. If I called any of those guys right now, I'd be like, hey, dude, can I come over? We play one tournament together, and any of them, like, we still text, we still talk, we're still friends. If I talk to my buddy, like, same thing with 40K is that we are fighting the isolation of I'm in my basement alone, but I'm here with y'all and we're talking, and I'm sure we'll have follow-up conversations. So there's this community building, which PTSD, because you want to isolate, allows you to have that outward expression and connection to the people. Because at the end of the day, what we're trying to do is, how do we take a person that has PTSD and get them to not just back to their normal functioning, is how do we make them better in the sense of, this has made them a better individual. That combat has allowed them to go into a board meeting or a construction site and take charge and build that, right? This is us playing at Adepticon. These guys, we were playing them. It was the last game. It was stressful. We were battling for the top 20 in this game, and they were getting a little spicy. And then he's talking to 2 combat veterans that are getting a little spicy, but we were able to kind of just like handle the situation where they, maybe have not been as adjusted to high stress environments. So, wow, that slide didn't turn out as low as I thought. So the goal is, how do we use this in therapy? That's the problem, is it's very, very long. Everyone knows that, versus, and how do we get the ROI for the therapeutic response, and how do we monetize that, right? Because we all have student debts if we're counselors or doctors. I know I have $250,000 in student debt that I'm paying off. So how do we monetize that in a way that helps people and then helps us to be able to offer that in our clients? And the thing is that it'll become from our research, right? So we're going to have to kind of eat the money and give up the ROI really for a while, so that way we can kind of drive that into the field. So how do we integrate it is really what I like to do is, I get part of groups, and then I become kind of the SME of, like, hey, emotional distress. And then while we're playing games, I'm able to kind of talk to my gaming group about things that are going on in their lives, or even when I'm at tournaments. And then I run a D&D therapy group, because that's only about, an hour of the game, and then I can do an hour processing, because you can have about 7 to 8 people and you can call it group therapy. So that's what I'm working towards, is how do we do this in a clinical setting? And the most important thing is really, how do we take 40K and make it to a healing pathway for people, right? Because we know we can do it one-on-one, and then how do we do it as a collective? How do we do this? Obviously, not everyone on here is going to be a therapist, but how do we do that as players? And how do we give guides to players to, hey, there's that weird guy that's in the gaming group. Well, maybe the weird guy is not so weird. He's just got issues. And how do we kind of tease that out and utilize the game to kind of go from there? And that's my speed through there, so I apologize if I took too much time, but there you go.